What's up, everybody? Welcome to this week's episode of the Well Man's Podcast. My name is Brian Brosey. I'm joined by my friend and co-host Keoni Tita. Keoni, how are you today?
I'm doing wonderful. I'm excited about the topic. I see it a lot in my clinic, and we're talking about bruxism. And bruxism is just another name for grinding or clenching teeth, gnashing, grinding, clenching your teeth. And it seems to be related to stress or anxiety. So I see it a lot in my clinic, and I remember when I was young, spending the night with my cousin who I've never heard anything like this, where he was grinding his teeth so much that I thought he wouldn't have any teeth left by the end of the night. And it's fascinating because you can actually see telltale signs of somebody who grinds their teeth quite a bit. I mean, you can see that the surfaces of their teeth are kind of worn down and almost smoothed out. They don't have the natural contours to the edges of the teeth. They just look like they just like are straight. If you look at the front teeth, they just look like somebody just sanded them down straight and nice all the way. And that's pretty much what you're doing. You're like sanding your teeth down and grinding them down. And over time, it definitely can, it takes away the enamel and destroys the teeth and leads to all other kinds of issues. So it's a big concern for many of my patients, and many of my patients come in for acupuncture to help with that. And then we do some of the other things that we'll talk about in this podcast about it. There are two types of bruxism. One is, bruxism while you're awake, and the other one is sleep bruxism. You can have both, one or the other. I think most people can relate. Sometimes I certainly can. If you are sitting there and you're like concentrating on something and you just feel like your jaw is tight and you don't realize that you're like clenching your teeth.
Right.
I mean, think about that 100 times worse. All the pain that can create, in your temporal mandibular joint, creating headaches, creating tension, and that type of thing. And so there's all kinds of things that are related to it and associated with bruxism. So the common signs and symptoms are, of course, tooth pain and sensitivity. This is kind of fascinating. Somebody who chronically does like grinds their teeth, it'll actually kind of change the contours of the external face. So you'll actually see like the corners of the mouth droop a little bit. It almost looks like they have like a puppet chin, some sort from, that could be one sign. Definitely facial pain. And then some signs are where you can see or feel with your tongue, like teeth marks on the inside of your cheek, like where you've actually been like almost like biting your cheek. And sometimes you'll see telltale signs kind of on your tongue where you have like tooth impression marks on there from it. Definitely pain in your temples. That's a big one that I see a lot. A lot of people are treated for headaches due to bruxism.
Yes.
And that, so yeah, you treat the headache, but you're not really getting to the cause. Bruxism is a big cause of lots of headaches. You see the teeth are flattened. You see that they may be chipped. A lot of times from grinding, you're almost like wiggling the tooth out of the socket so they can be loose sometimes. Tight, tired jaw muscles are a big one. And then another one is, what is it? Oh, neck and jaw pain, like where your neck is kind of tight. So that's another one there.
Yeah, absolutely.
And let me see. I want to make sure I hit this lip. Okay, course sleep disruption. If you're doing it at night, it could definitely disrupt your sleep. Talked about TMJ. Fractures of teeth. You can see that going on. A lot of times you can hear or feel yourself like tapping your teeth together. You get a burning sensation on the tongue. A lot of times you can see not only the corners drop in your mouth, but you can also see like hypertrophy of the muscles of mastication, like the masseter muscles. You get really good like excessive tonification in your pterygoid muscles. Those are the ones in the back of your mouth. You get restricted mouth opening. A lot of times you can feel clicking in the temporal mandibular joint. And the list can go on and on with any type of facial pain. I mean, I, I wouldn't be surprised if trigeminal neuralgia is related to this, and that's excruciating. Somebody who has that bad, that's where you just have that facial nerve pain.
Yeah.
That may be related to this too. And then, so the real interesting thing about this is nobody really knows. Like, we don't know what is the main cause, or what is the root cause of this. We have some idea of things that can be related to it. Like, we know that risk factors for it are like alcohol use, definitely anxiety, sleep issues like sleep apnea, cigarette smoking, snoring, definitely a high stress lifestyle. Some nutritional deficiencies are attributed to it. Malocclusion, just basically meaning that your teeth don't come together from the upper and lower jaw appropriately. So, they don't hit each other appropriately. So one side may be off or the other side may be off. I think people can relate to that. Like, if you ever gone to a dentist and you had like a filling that just doesn't feel right, the dentist has to go in there and like sand it down almost to just make sure that your upper and lower jaw kind of close together appropriately. Some people have like unnatural cross bites or over bites, things like that certainly can do it. Teeth crowding, where the teeth don't come in appropriately, which certainly can cause malocclusions. And then there's certain medications. So a lot of times I'll go through medications with people and see what is actually going, if the medications are related. These are like, antidepressants, dopamine type medications like Parkinson's medications, amphetamines, some type of street drugs. Cocaine is definitely can cause that. So there's a number of medications, and then there's some like Down syndromes can certainly cause that. So it's most common. Bruxism is most common in young children. This is where when I was an adolescent and my cousin was a little bit younger than me, he was sleeping in the same room as me. I mean, he kept me up all night grinding his teeth. He was like, I don't know, like 10 years old or something. And then there's a genetic component to it. Other things that it can be associated with are other medical disorders like Parkinson's, dementia, reflux, GERD, epilepsy, definitely sleep-related disorders like we talked about, sleep apnea, night terrors, bad dreams, and then attention deficit hyperactivity disorder, ADHD, can also be attributed to it. Go ahead.
The list of kind of signs and symptoms there is really helpful because, like you mentioned, I mean, you heard it in your cousin, and quite often, the partner or whoever is nearby the person hears it and becomes aware of it. But it really gives you some stuff you can kind of look out for to see if you're doing it by yourself. Are you waking up with jaw pain, or you seeing these changes in contours of both the teeth, or the contour of the gum or the lip from you kind of chewing on it throughout the night.
Right.
So you kind of have a list that you can go through and self-diagnose or try and further investigate if this may be you.
Right. And if you go through that list and you think that may be you, then there are some nice kind of self-help remedies that you can do before you go to the more conventional treatments. So what is the main conventional treatment here? I mean, the main conventional treatment is a mouth guard. And most of the time it's diagnosed by a dentist, right? It makes sense. The dentist is really looking at your teeth, and they can just look at your teeth and get an idea of what you're doing. When it's really obvious though, like even me as a practitioner and you as a healthcare provider also, if you know what you're looking for, you can get an idea of what's going on if you look at the teeth.
Mm-hmm.
And it's one of the first things I think about when somebody's coming in with like tension headaches or any type of headache. I'm going to ask about this. And a dentist can really get an idea of what to do with this. And one of the main things is using a mouth guard. And I have some patients who really like the mouth guard. I mean, but the mouth guard is just basically symptom management. I mean, some of my patients though just have chewed right through their mouth guard after a while, and they have to replace them over time. So they're still doing it, but the mouth guard, what it does is it protects the teeth, right?
Mm-hmm. Right.
But is it really getting to the root cause of that?
Right.
And then the other thing about it is, how comfortable is it to wear a mouth guard to sleep? I mean, most people, at least initially, would find it very uncomfortable. I think there's an acclimation period wearing one. You have to kind of get used to it, and then probably you can sleep with it. And then some people even use it during the day. A dentist can also see if there's malocclusion there, and they can restore your bite to a normal bite. And usually, sometimes that will take care of it. And so that's just, certain dental procedures that can do that. A treatment that can kind of related to acupuncture, but you're actually injecting, a toxin into the muscles and stuff, is Botox. I mean, that is a treatment that may help. I certainly don't recommend it. I would go acupuncture before I'd even do something like that, because
You're real slack jaw.
it can lead to muscle weakness. Yeah, no, exactly right. It can lead to muscle weakness and to difficulty swallowing, and there's side effects that can certainly happen there. Also, another treatment conventionally is taking muscle relaxants. Well, we have an idea what those do, right? Some of them can be addictive. They're not good long term. They can cause GI stuff. I mean, so you're talking about a whole host of other negative side effects.
Right.
With most of our podcasts, Brian, when we go through this, we talk about, okay, what are the first things we do? We talk about lifestyle. We know from the studies that exercise helps with this. It kind of takes the edge off of anxiety, right?
Mm-hmm.
If you exercise, I think it's the best treatment for anxiety and depression,
Right.
at least to manage it long term.
Mm-hmm.
Things like practicing meditation, and then even sometimes, like a mental health support services for somebody who has really bad or who has PTSD, which is probably, related to it in some instances, or just really bad general anxiety disorders where bruxism is part of the picture. So that can really help. Most people that are doing it during their sleeping hours, you can go through the whole sleep hygiene thing to just help yourself relax before bed. We talked about this in our sleep podcast, white noise, go to bed at a regular time. Sometimes a warming compress on tight muscles of mastications on your cheeks and stuff can certainly help. Drinking like certain herbal teas like chamomile or lavender or valerian, that may help. Limiting TV use and all that. Meditation is a big one, focusing on it just helps tonify that parasympathetic system, which can really help. Another thing that some people are in the habit of, I know I used to be quite a bit, is just like chewing on stuff, like chewing on ice or chewing on like things that are not food, whatever, just constantly working your jaw kind of certainly doesn't help, and that should try to be so chewing on anything that's not food is probably not a good thing. Maybe eat gum, avoiding chewing gum if you really are like chewing gum.
Yeah, it can be the cause of a lot of neck pain
so
as well,
that's
Keoni.
kind of the list.
All right.
Oh, no, absolutely. Right. So anything that you're doing in the face, it's related to the neck, and from there, it's like, everything's related to that whole chain down into your upper back, so it's one of those things that you really, really want to address. So that's kind of like the lifestyle stuff. That's then the conventional treatments. All right. And unfortunately, a lot of people don't do that stuff before they even go into the natural treatments. They go to the conventional treatments. They sometimes don't even think about the lifestyle stuff. But one of my favorite natural treatments for this, and I know you can guess it, is magnesium, right? Magnesium is a natural muscle relaxer, and there is some indication that people that have bruxism may be subclinically deficient in magnesium. And there's actually an article in some obscure medical journal in 1980. And it was basically my clinical experience as a doctor who wrote it up on bruxism and magnesium. And he said, without a doubt, like if I supplemented somebody with magnesium long enough, the bruxism tended to go away.
Wow.
All right. And the reason why I put that out there, because clinically I've seen that too. And there's some evidence backing that up. So taking some magnesium, like 400 to 600 milligrams of magnesium, my favorite type is the bisglycinate, but there's any form will work, seems to help. Not only does it help with bruxism, but it also seems to help. I mean, bruxism can be kind of related to a form of facial tic, if you will, in a sense. And
Right.
magnesium even seems to help that also. Think about what you're doing. You have a form of tetany there. Your muscles are kind of tight. Magnesium is a nice natural muscle relaxer. Most people are subclinically deficient in it. And at the worst case scenario, you're going to improve something.
Right.
So that's like my go-to. Like if somebody's not on magnesium and deal with this, I want them on magnesium. That's going to be kind of one of the things that I do as far as treatment goes. There are other vitamins and minerals that may be related, but nothing as definitive, I think, as magnesium. But I always recommend a multivitamin, that kind of covers all bases for most people. Sometimes just a relaxing tea like chamomile, we talked about valerian. Valerian has natural muscle relaxing properties like magnesium does. It can certainly do the body good. It helps with sleep too. Lavender is another one. And these things can work, like lavender can work as, a diffusing lavender oil into the air. It may help. Also, you can massage lavender oil, especially if you have a good product, externally into these muscles. And you can even, if you have a good one that can be used internally, you can certainly massage lavender oil internally. I actually use a lavender capsule that's pure lavender essential oil that is made specifically for oral consumption. I use it primarily there's good research on lavender as being a good antidepressant. So I use it primarily for mild depression. But you can actually, that will help too by taking it orally. Warm compresses we talked about. And one thing that people can do that is very simple that really have this issue is just an external massage on these muscles of mastication all over. Like it can take 10 minutes. And that's externally. Anybody can do that. Sometimes just doing acupressure on these points all over your upper and lower jaw can help alleviate some of that. So the other way you can massage is just internally. For me, it's difficult because and a lot of people have this. I have a pretty strong gag reflex. So anything that goes in my mouth besides food, I'm going to gag. And a lot of times the muscles of mastication, and I'm specifically talking about the masseter muscles and the pterygoid muscles, the lateral and medial pterygoid muscles. Those are the muscles that sit back where the hinge of the joint is primarily in the mouth. And those muscles you can really get to. You can get to some of them externally, but the pterygoids, it's not so easy to do. And there are YouTube videos on this, how to do self-massage internally. In my clinic, people that have this, I'll refer them to my massage therapist because my massage therapist knows how to do these techniques, and she'll, get into their mouth and massage them in an appropriate way, and can actually demonstrate to them how you do this. And I'm going to try to verbally right now, try to describe it to people. But, again, talking to somebody who knows how to do this. Do you guys do this at all? Do you guys train
I've done
in
this before, specifically orally too.
Oh, okay.
Mm-hmm.
Yeah, I figured PTs would be the main one, so that can at least do this for people. But so correct me if I'm wrong, Brian, because I'm just going kind of on memory with this. All right.
Mm-hmm.
But the lateral pterygoid muscle, the way I do it is I'll place like an index finger. I'll tell my patients to place an index finger into their mouth under the cheekbone, right? Point the finger up to the opposite eye. Apply pressure to the muscle. So you're pushing. You're going internally, and you're applying pressure on the muscle until it relaxes. So, and there's YouTube videos on this, so you guys can definitely check this out and see. You just want to check the position on the finger. You can like move your jaw in opposite direction, everything, and you'll feel the lateral pterygoid muscle like kind of contract under your finger. I mean, is that a decent description of that?
Yeah, that's a decent description.
I know it's hard to do.
Yeah, I would also use the cue of kind of, we all have kind of that hinge point that we can feel in our mouth. And if you're internally working towards that hinge point, just kind of sink internally more towards the throat with that. And it's very light, especially these internal ones. You really don't need a lot of force, and you just can gently, like you mentioned, acupressure it or kind of gently stroke it and really get a lot of relief. But going right to the, where you feel the crease where your two jaws are meeting and it feels like in your gums, and just kind of sink in from there. And then I also like doing the masseter on the side as well. So this would be on the inside of your mouth, but outside of your teeth, right? So we're in between.
Right. So between the cheek and the teeth.
Yep. Between the cheek and the teeth. And you can really grab that masseter muscle and get a good full, real intense massage to it if you want, just by the nature of being able to grab it and kind of massage it from both angles.
Yeah. Okay. So the masseter muscle kind of pinch the cheek.
Yeah. So you could work your way back to that corner again.
Yep.
And I'm kind of doing it externally working, but I'm trying to go under that masseter muscle. So the masseter muscles really, these are tough to talk about, but it runs vertically from, your jaw on the bottom to the top where you have that maxillary process, kind of that maxillary arch.
Yeah.
The arch, what is it called? The zygomatic arch that you have. It's kind of like the bottom of your eye that you can feel, and it's going to run all the way up to there on kind of the side of your face. And one we're failing to mention, Keoni, just that I would add to this list is the temporalis. So that's, like you mentioned, the side of the headaches where you have a lot of those tension headaches. That temporalis muscle comes and has an attachment at the TMJ joint as well. So I get a lot of relief, acupressure, and kind of massaging that temporalis as well. And I find it to be really helpful if people work in a fashion from, just whatever works for them, top to bottom or bottom to top. So like starting at the base of the jaw and working their way up to include fully the temporalis, but getting like a full, because these are 4 muscles we really want to deal with: the temporalis, the masseter, and then those 2 pterygoids that you're mentioning. And if you go systematically, you can really find some
lateral and the
relief.
medial.
Yeah.
Right. Yeah. So I think it's better if you get somebody who knows how to do this and can show you, and
absolutely
you'll get it. The medial pterygoid, I mean, I usually just take my index finger and go on the bottom of the jaw and run it on between the teeth and the mouth. I know I'm not explaining this right. But you move along, like you said, you move to that hinge point, right? Move along the gum line and
you'll honestly be able to investigate, where you feel tender. Like I mentioned, especially the orally, and I know I was a little heavy-handed when I initially started Keoni, and I was a student doing this. But when you're internal, it is very light amount of force that's required. So you'll kind of get that feedback and how the how you're feeling, you putting the pressure on it yourself, and kind of be able to X marks the spot based off kind of the tenderness. Because obviously there's a lot of tissue there, but there's not, a ton of built up muscle like these 4 muscles of mastication are going to be. So you'll probably know when you found it, both in it speaking to you and it's going to feel very muscular.
Yeah. I think if people just look, this is something 100%. That I do recommend people do that are dealing with bruxism. So temporalis muscle. Check that out. Just look at the anatomy, the masseter muscle and the pterygoids, lateral and medial. And there's YouTube videos on how to do this self-massage, both externally and internally. It really just takes like 5 to 10 minutes to do if you can do it yourself.
Yeah, absolutely.
Yeah, and for some of my patients, it's given them tremendous relief.
Absolutely.
Another thing I just want to mention out there, because it is, CBD is pretty legalized across the 50 United States, THC and almost the states also. But cannabis it can be a good alternative for relieving bruxism. And, it depends, of course, on the individual and your state, but cannabis can really help relieve anxiety and depression. There's a got to that. If you listen to our cannabis podcast, I mean, you want to make sure you're getting the right form. I like the indica form for relieving anxiety. I know if I do the sativa form, I get extremely anxious. So just make sure the form is right. So I think if you get the sativa, at least if I did, it may make bruxism worse for people. But if you get the indica in the couch form, so to speak, it helps just relax you, go to sleep, and it can help with that. So there's some indication now in the research, and it may work better and may work acutely than what magnesium does. Magnesium will be more of a long-term solution if you take it on a regular basis, where, cannabis may really, really help with this too, where it just kind of takes away the angst, so to speak, especially if you know the right form. But even CBD, there's some good anecdotal evidence that CBD can help with it too. Yeah. But I like massage and magnesium. That's my primary thing. If we're not getting anywhere, I will definitely use, kind of the CBD stuff that can help. If the teeth are just really being, kind of degraded over time and it looks really bad, I mean, by all means, you need to have a mouth guard until you kind of resolve the issue.
Yeah. As you work towards that root cause.
Anything else, Brian?
No, not really. I think a lot of great things that you can, especially kind of incorporating into your overall sleep hygiene, some of these activities, obviously like the magnesium, self-massage, all that kind of stuff just can be very helpful, not only for the bruxism, but kind of unwinding throughout the day and ensuring you don't have the bruxism throughout the night.
Right. And, the thing I didn't mention, I use acupuncture a lot for this. Okay. So sometimes I'll do acupuncture, certain acupuncture points, mainly along those points, right? Those muscles of mastication I'll use. I mean, what we call the TMJ point, which is right here, especially it's at that, right there where your ear is, the front of your ear, and along the jaw upper and lower, you can use acupuncture. And sometimes I'll do electrostim to just help relieve the tension there. The other thing, you talked about neck pain and stuff. This is also cupping can certainly help, especially at the back. So a lot of times I do a front treatment and then I'll do a back treatment. With that being said, massage helps. Definitely see your PT also. You can really get an idea of what's going on as far as your muscle tightness, where it is, postural changes from this and everything else. So a lot of times the bruxism speaks to a wider constellation of other things going on.
Yeah, absolutely. And then a PT, I'll just throw out that it can also help with the chewing, any TMJ problems. So kind of working on proper opening, closing. You kind of mentioned some of that clicking, popping that we can maybe have with TMJ joint, Keoni. And that's something that can definitely be addressed as well. And just to further add to the neck pain real quick, I have been, just the more I read about the deep neck flexors, so maybe we can do a podcast on neck pain here soon, but the deep neck flexors that help control kind of the lordotic curvature of your cervical spine, and they can really help take a brunt off neck pain and kind of set you up for a better posture that's more comfortable. We are continually kind of inhibiting our deep neck flexors with constant gum chewing and chewing. So all of that really ends up not being really good for our deep neck flexors, our overall cervical posture as a whole. So that's just something I'm finding more and more interesting. Kind of got me to stop chewing as much gum, that's for sure.
Oh, that's very interesting. I wasn't aware of that.
Yeah, and I'm
talking
so overall,
you would recommend chewing.
Yeah, I wouldn't. Your longest coli and your longest capitis. Those are two really deep neck flexors, and they're really important for kind of controlling that lordotic curvature of the neck. And I'm finding more and more I read, they tend to be inhibited or get inhibited from this kind of constant chewing and talking, because we basically, in the way the posture's set up, I mean, you're using a lot more internal kind of muscles of voice or vocalization, and it's and also the
Yeah.
chewing, and it's inhibiting these deep neck flexors from working optimally, and that puts us in these bad postures, causes a lot of neck pain. But so that gum chewing may
Oh,
be
interesting.
not just further exacerbating your bruxism, but also your neck pain.
Okay. Yeah. And that's definitely supported with some of the stuff I read
Yeah,
from the science out there. So, all
absolutely.
right, well, very cool. Are we
All
missing
right.
anything? I mean, hopefully we gave you guys a good like overview of things that you can do yourself. Definitely, if you're suffering from this, and I have a lot of people that are, definitely check out those videos on the self massage. They can really
Absolutely.
do wonders for you.
Yeah, absolutely. Yeah, I think you got a good kind of list of things you can work your way through. And also, like I mentioned at the beginning, good self checklist, because you
Yeah.
tend to find out your partner, or the partner finds out that your significant other is doing this. So it is definitely
Hmm.
beneficial to be able to check yourself.
Yeah.
So so you don't end up like Keoni's cousin, who he's still holding this grudge against.
Yeah, keeping me up all night. Well, it's interesting. A lot of people, at least from what my dentist has told me, and you probably know this too, Brian. Like, your teeth should not be in constant contact with each other, right? I mean,
Mm,
there should be space between them during your sleep and waking hours.
interesting.
Teeth really, yeah, your teeth should not be contacted against each other chronically. And a lot of people who have bruxism, they feel that, like when they're conscious and aware of their teeth, they're like, yeah, my teeth are constantly, touching each other. There should be a
Right.
little space between them normally. Like, if you're not doing anything or chewing anything, there should be some space between. They shouldn't be resting on each other, at least according to my dentist. So I'm assuming she
He
and
went to
he
school.
knows what they're talking. Yeah. Yeah. I mean, but it makes sense, right? I
Right.
mean,
And for me, it
it
speaks
just
to that the initial aspect of kind of the way I treat patients is developing that awareness and having that awareness
right.
into our jaw, the awareness of what posture is correct, the awareness of good and bad neck, bruxism, jaw hygiene, that sort of thing,
Right.
is the first step.
Yeah, we need to get a dentist on to
We
maybe
do.
clarify some of these things. But the other thing is like I when you're sleeping, I think from what I understand and what I've read is your tongue should rest against your upper palate, right? It kind of
Mm,
should rest against that, and it almost like exerts maybe a minor force upward. Your teeth aren't contacted in a sense. So
interesting.
I don't know.
Yeah.
Tongue may be something that's going on there too. But
Well, and I know just talking about those two deep neck flexors, in one of the books that I was reading that talked about kind of describing how to work those neck flexors more efficiently, they have you for the exercise place your tongue along the roof of your mouth, and not clench the teeth. Teeth are
okay,
supposed to be lightly touching, but it just kind of, like you said earlier, kind of what we're reading is like-minded. We just need to get a dentist on here or some TMJ expert.
right, right. All right.
Awesome, everybody. Thank you for listening. If you found this helpful, please share it with someone else who may find it helpful. Leave a review. We are on YouTube, all Spotify, Apple Podcasts, all podcast services. So if there's one you listen to, please leave us a review. Let someone know so we can help more people. And until next week, be well.
Bye, everybody.